We are back to tackle a few final COVID vaccine questions with Keith Grant and Dr. Melisha Cumberland of Hartford Healthcare. Mr. Grant, we are giving you the first two. Cynthia and Meriden wrote about her dad and his wife who are snowbirds. They're in their 80s. She's wondering what happens if they are out of Connecticut when it's their turn to get the vaccine. Do they get their shots in Florida or do they get them when they return to Connecticut? We also had a similar question from Bill in Plainville, also a snowbird. He asks, if we get our first shot here, can we get our second shot in Florida? Mr. Grant.
So that's a very good question for a number of reasons. So the processes that are being developed in Connecticut are very similar to the processes across the country. So in regards to, again, I'm going back to contacting your healthcare provider. If your healthcare provider is in Connecticut and your intent is to get it in Connecticut, I would say communicate with them and set up a time frame that is good enough for you. In regards to the second dose, we've gotten a lot of questions about this. I think logistically, what most institutions will be doing is trying to ensure that wherever you get the first dose, you get the second dose. However, based on the data that we're seeing right now, there's nothing that shows that if you get one dose in Connecticut and one dose in Florida, it's going to make much of a difference, so to speak. So more to come. I'll get some more specific on that and make it public.
Okay, great. Next question. Luke in Colchester asking, once healthcare workers and others first in line get the vaccine, how will he know he's eligible as an ordinary person? And where will he find the vaccines once they're open to all? Dr. Cumberland.
So, Luke, that's a great question because right now the prioritization is going to healthcare workers, then nursing home residents and, other essential personnel. So once the supply actually increases, right now we have a limited supply, but once the supply actually increases, there is process that is happening, really amongst the government and through our healthcare system into where can we get these pharmacies, such as Walmart, CVS, Rite Aid. They're all in the talks of trying to really get their supply of the vaccine once it becomes really readily available to the public. And then there's going to be less strain on trying to schedule and prioritize the public. But of course, it'll be in a fair way that we try and prioritize those who are sicker and need it.
Another one for you, Mr. Grant. Tony in Wethersfield wants to know, how will homebound seniors get the vaccine shots?
So, one of the things that we've done over the last few months is trying to figure out how to distribute this in the best way possible. And there's a number of logistics that are still being worked out. And this is definitely a question that we're having at the, Governor's Advisory Committee. And again, this is one of those things that I will say I will have to get back to the state of Connecticut with details on it, because there's a number of people that are asking this very question and people that are within the group that will need the vaccine. So we will have details on this, and we'll ensure that, we're sending these out.
All right, that sounds good. Our final question of the night coming from Lee in Portland, who asks, will we have to get these COVID vaccinations every year like flu shots? Dr. Cumberland.
So there just isn't enough data as of yet to see how long that the protection lasts from the virus. However, the FDA is, they're speculating that the protection from the virus can last for months and maybe even up to a year. So it is likely that you'll need to get one at least annually. Right now, we're looking into, do we need to do it, before the year is out or somewhere mid-year. So still not enough data, very new vaccine. So more information to come.
A lot still to come. We want to thank you so much, Jeff Flax, Dr. Melisha Cumberland, and Keith Grant for joining us tonight. We appreciate all of your insight. We couldn't get to all of the viewer questions today, but our goal is to answer some of them every weekday on Eyewitness News as we get closer and closer to the end of this pandemic. The good news, better days are coming. Thank you so much for watching, and I'll see you back here tonight with Mark and Bruce for Eyewitness News at 11.